Here's a moment for public health on two subjects that I think are really important to cover. And this was especially spurred by my trip last week speaking at Johns Hopkins for an NICN conference, which is their Neuroscience Intensive Care Nursery. Got to walk by their public health building. Johns Hopkins Public Health is one of the most trusted institutions in the country, longstanding. And there were two things that really stuck out in the conference material that I think are important for parents to know about that I want to highlight today. What is the greatest thing since sliced bread? How about adding folic acid to it and reducing neural tube defects by 35% since 1990? There is tons of misinformation about folic acid and folate on this app, but there's plenty of people that are credentialed professionals, lots of the OBs and the MFMs that have content and share it out there, and public health professionals are sharing because there's good things that happen when you do things like enriching bread with folic acid, which they have done since the early 90s. Decreasing these neural tube defects by 35%. Anencephaly, which is a type of neural tube defect, is when the brain does not properly form. These babies often, if they are carried to term, many choose to terminate for medical reasons ahead of time, but they live maybe a minute or two after they're born. They are not compatible with life. The majority of them is very tragic. This has been decreased by 35% by this public health intervention. Secondarily, spina bifida is also considered a neural tube defect, and the incidence of spina bifida has dropped dramatically by enriching bread off the shelves with folic acid. So yay, public health. So the second public health intervention I want to talk about is the vitamin K injection and babies getting vitamin K at birth and the importance of this. This again is not a new intervention or new standard of care. This has been implemented in the US since 1961. So we have over 60 years of safety and efficacy data for the neonatal vitamin K injection. And when we talk about VKDB or vitamin K deficiency bleeding, we are talking about brain bleeds. We're not talking about an uncontrolled bleeding in an arm. We are talking about the baby's brain, and why this is so important and why this was critically important is because this saves babies' brains. It decreases death and disabilities in babies. The misinformation machine talks about a black box warning, and that is for adult dosage. This is not applicable to neonates. And let's talk about the efficacy data and the safety data behind the two types of administration for vitamin K real quick. There's intramuscular, again, that's a shot in a muscle administered through a needle, similar to a vaccine. And that administration alone has decreased VKDB across all levels by 92%. The other option is an oral option for babies, and that, although the efficacy data is still very good, is not quite as strong as the intramuscular version. The oral version of the vitamin K will decrease VKDB by 80%. Now, 80% is still very good, but it's not 92%. So these combinations of interventions have decreased, again, VKDB by 97% over the past 60 plus years. Public health, it does exactly what it's designed to do. And these researchers do this to look at what interventions can be done at a large scale that are safe and effective to improve quality of life, decrease issues like neural tube defects and other things that go awry in growing a baby and in maternal and infant health. I hope this is helpful. I hope this gives you some additional clarity. I know that for our families that go on to consider adding more children, we look at every single decision a lot heavier, and I'm sure there's others out there that might see this as well that do. And especially in this era of misinformation and fear-mongering and warping and twisting data and really doing a lot of people a disservice, in particular, putting people's lives and their babies' lives at risk. So hope this is helpful. If you have additional questions, there's some additional creators that I'll tag here that are OBs and MFMs that have also provided excellent information, as well as some neonatal neurologists. So the TikTok Brain Doc, who is also on Instagram, Dr. Justin Rosati does a lot of this work as well. And there's some excellent additional maternal and infant health information out there that clearly will outline the same data points that I've covered today.